Fatigue is not just tiredness. It's when you have low energy that doesn't improve easily with rest, and it affects your daily life. Fatigue is extremely common. Around 20% of people feel constant or frequent fatigue during their days. Most fatigue isn't caused by diseases. Instead, it comes from psychological conditions like stress, anxiety, or depression. About 20% of cases are caused by actual medical conditions. Fatigue is more likely psychological. If it gets worse or improves depending on what you're doing or who you're with. Also, if along with fatigue, you have low mood, loss of interest, feelings of guilt or worthlessness, it usually points to psychological causes. On the other hand, fatigue due to disease typically worsens during physical activity. It improves with rest. Psychological fatigue is often worst in the morning and gets better throughout the day. Clear signs can help differentiate if fatigue is from a disease, like fever indicating infection, losing weight without trying, pale skin, slow heart rate, swollen glands, joint swelling, or shortness of breath from heart issues. Even though diseases aren't the most common cause of fatigue, we still need to rule them out first. The most common diseases causing fatigue include anemia, diabetes, hypothyroidism, and heart problems. Here's how to check if fatigue is from a disease. Measure temperature, blood pressure, and observe skin color, whether it's pale, normal, or yellowish. Blood tests typically include complete blood count for anemia, thyroid function tests like TSH and FT4, and inflammatory markers like ESR and C-reactive protein. Vitamin B12 tests are essential to exclude deficiency-related fatigue and nerve issues. Iron tests, such as serum ferritin, pinpoint the source of anemia. Urine analysis checks for protein, blood, or sugar to rule out kidney disease, infection, or diabetes. If fatigue is psychological, the most common reasons are depression, anxiety, burnout, or chronic stress, persistent low mood, loss of interest, morning worsening, feelings of worthlessness, or excessive guilt are signs of depression, excessive uncontrollable worry about everyday matters, restlessness, muscle tension, irritability, and fatigue that spikes during stressful periods indicate anxiety, chronic emotional exhaustion, detachment from work or duties, and a reduced sense of accomplishment point towards burnout. If someone persistently worries about symptoms despite normal medical tests, this may be somatic symptom disorder. About 20 to 30% of people with chronic fatigue have chronic fatigue syndrome. This unexplained tiredness isn't due to diseases or post-viral conditions. It starts suddenly and has no clear cause. Fatigue worsens notably after physical or mental effort, and rest doesn't substantially relieve it. This fatigue lasts more than 6 months. Physiologically, fatigue can occur because toxins accumulate in muscles, or there's low ATP production, the muscle's energy source. Alternatively, fatigue can result from neurotransmitter imbalances in the brain, levels of adenosine and serotonin. Based on these principles, here are the main treatments. The most critical treatment is addressing any identifiable underlying disease. If fatigue is psychological, the most effective therapy is cognitive behavioral therapy. It identifies and modifies unhelpful thoughts and behaviors that maintain exhaustion. For example, someone might think, if I can't work at full speed today, I'm worthless. This black and white thought can be reframed to, small steps still move me forward. The second effective approach is a graded exercise program. It involves gradually increasing physical activity tailored specifically to you, avoiding overexertion. The goal is eventually to exercise around 1 hour daily. Mindfulness is another vital method. For example, body scan meditation, a guided practice focusing systematically on each body part, from toes to head, observing sensations without judgment. This enhances awareness and reduces the body's stress response, breaking the cycle of tension and exhaustion. Mindful breathing, or sitting meditation, involves 10 to 20 minutes, focusing attention gently on your breath, noticing each inhale and exhale. This practice improves emotional control, reduces cortisol, and enhances sleep quality, as shown by studies including cancer-related fatigue. Morning bright light therapy, at around 10,000 lux for 30 to 60 minutes, helps regulate circadian rhythms and directly boosts alertness. Studies on cancer survivors and others report significantly reduced fatigue with minimal side effects. For some, power napping is highly effective. Brief naps of 10 to 20 minutes improve alertness, reaction time, and mood without causing grogginess afterward. Controlled caffeine intake, about 100 to 200 milligrams, roughly 30 minutes before demanding tasks, can enhance vigilance and reduce perceived effort. However, avoid late-day doses to prevent disrupting sleep. Supplements and therapies include phosphocreatine buffering, where creatine supplements increase muscle phosphocreatine stores, helping ATP regeneration and delaying muscle fatigue. Manual therapies, such as massage or active recovery, improve blood flow and clear fatigue-inducing metabolites like lactic acid from muscles. Caffeine also works by blocking brain adenosine receptors, reducing perceived effort and delaying central fatigue. Neurotransmitter modulation through exercise or medications like SSRIs, SNRIs, and dopaminergic drugs rebalances serotonin and dopamine, alleviating fatigue and improving mood. Regular endurance training adapts muscles, boosts mitochondria, and delays fatigue signals. Antioxidants like N-acetylcysteine replenish glutathione, protecting mitochondrial function and delaying fatigue by scavenging harmful oxidative compounds. In the end, fatigue is not merely exhaustion. It's a complex interplay between mind, body, and environment. When we identify its roots, we reclaim our strength, vitality, and truly begin to thrive.